Are smaller healthcare organizations losing its personal touch in the shadow of large systems? Discover how we can leverage community-based care and integrate strategic relationship to overcome these barriers in today's episode. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Has the U.S. healthcare system lost its human touch in the pursuit of industrial scaling solutions? Today, we're going to talk about this very subject of how and why exploring smaller community-based healthcare organizations might just be the remedy that we need to bring personality and personal touch back to the forefront of healthcare. Today, we have Brian Jackson here with us. He is a pathologist, a clinical informatist, adjunct professor of pathology at the University of Utah, and the founder of Hippocratic. Capitalism is a newsletter which you guys can all read on LinkedIn, so go check him out. He has over 2 decades of experience in both clinical laboratory and healthcare IT industries. During his time as an executive at ARUP Laboratories, a large national lab testing enterprise of the University of Utah, he observed the differences between clinical culture and business culture, but also how the two can combine for sustainable business success. All right. Hi, Brian. Thanks for joining us.
Thanks, Sabrina. Thanks for having me on.
Yeah. So tell us more about how did you figure out clinical laboratory pathology was your passion and niche that built your career out of it?
So I got started back in the late 80s, early 90s in clinical informatics. Grew up in Salt Lake City, where Intermountain Healthcare was one of the early leaders in home-built electronic health record systems. So, out of high school, I was working as a programmer up in the informatics shop on their electronic health record. As an aside, I'll say it's been dismaying to see the way that a couple of the massive players have just sort of bulldozed past all of those sort of classic golden era EHR systems. But anyway, but working up there taught me that there's just there are these amazing opportunities when you get clinicians and technologists in a room together, doctors, nurses, software folks in a room together. Amazing stuff can happen, but it requires those relationships and the collaboration, which I think is really missing in a lot of sort of modern over corporatized healthcare. But anyway, it was those experiences that led me to want to go to medical school. And then when I finished medical school, to be totally honest, I was more interested in healthcare as a system than I was in necessarily, doing medicine, if you will, at the bedside. So pathology was sort of a natural, specialty that allowed quite a bit of freedom, but also had really broad reach across really all of the other medical specialties. So I did that, worked in healthcare IT for a little bit, and then ended up at a large testing business that just happens to be part of the University of Utah. And that's where most of my hands-on business education took place.
Yeah, I feel like people go into medicine for different reasons. And one of my business partner for Post Point Path, and he's kind of similar to your round, like was military, got out, got his PhD in IT, worked with a larger California Department of Health, and then thought, if I'm in healthcare, I better know more. Then he got his medical doctor and then went back to building business. So I feel like all of us have this kind of journey, right? We start wanting to be such a person of knowledge, a person of growth, and share that with other people. And while we're moving and twisting, winding, however we choose our paths, we get to a point to say, we see a problem, we see a passion, and how do we merge that together and then build something really solidified behind it? And you're in that phase now, is like the next chapter, right? You have grown so much. You help company to build. You've been part of University Utah for many years. And so what is it that you have been focusing on now that you are super excited about?
So my current transition, I still do some consulting for ARUP, but currently I'm working on a book project that's also entitled Hippocratic Capitalism, along with the newsletter, which is free, so anyone can feel free to sign up and read it. Again, it goes back to sort of the difference between medical culture and business culture. So coming from a medical training background, it was really eye-opening to me to read and learn from people who were in the healthcare industry, but not from a clinical background, and realize that there's a strong intellectual tradition behind business management. I think a lot of doctors look at business and they think, well, yeah, that's the money side. And it's like, no, it's not. I mean, there's money everywhere, but business management is not fundamentally about money. Business management is fundamentally about organizing to get stuff done better. And there's a lot that you can learn from that within healthcare. At the same time, those things can also be used in negative ways. And I think that's what we've seen with the massive corporatization of health systems and insurance companies and so forth. So my goal here is to try to evangelize a bit to how it really is possible for clinically trained people to take ownership again. That you don't have to be a pawn in the system or a cog in the system. I think clinically trained people can be in leadership roles. And part of that means shrinking the scale of this down to where it's clinical scale, it's not financial scale.
Yeah, I think that's the fine key, is how do we believe that when we work, we are trained years to diagnose problems, get the right testing, confirm our hypothesis, carry out treatment plan, and evaluating, make sure that treatment plan actually get us something, right? And then for some people, it's just simply symptom management. For other ways, we're trying to cure or at least slow down the disease progress in some way. Now, healthcare, I would say, when people think about healthcare, even the people in it, sometimes we get trapped in thinking it's identifying disease and solving something instead of, actually, it's a lot more broader. It is about prevention. It's about slowing down things. It's about how mental health and physical health all play into each other, and how other elements, as you mentioned, healthcare is not just delivering care. It's also the overarching of the workflow, the process, the experience we're giving to every single person involved in the process. And that's when you start looking into technology, wanting to solve and reduce human labor or errors in that process. And instead of thinking, AI or technology going to take over, we're going to lose our staff, lose our admin team. Not necessarily. It's actually, how do we work better all together, isn't it? And then not thinking too bigger scale. Everyone had to be part of a larger organization to be sustainable, to even survive. But we actually know a lot of physician leaders wanted to create their own subset, right? Their own community of how they wanted to serve.
Yeah, absolutely. Yeah, no, I love your description. The complexity of healthcare and the personalness of it, healthcare doesn't really work well with a factory mindset. I've seen really well-meaning healthcare leaders try to take learnings from, say, the manufacturing sector, and apply them into healthcare. And sometimes that works. I mean, I don't want to. Actually, there's a lot we can learn from manufacturing, but to wholesale turn a hospital or health system into basically a manufacturing organized setting doesn't actually work, because you need so much customization at the individual patient level that all you're going to do is totally alienate all of your patients and all your frontline providers and make them feel helpless in your effort to improve quality or whatever. And that's not actually improved quality when you're alienating all the front folks of the front line. So the role of technology, like you say, really needs to be to enable the folks of the front line to accomplish what they need to accomplish better, not to control them and replace them and that kind of thing.
Exactly. And also recognize their value, bring them to the conversation much
Absolutely.
sooner.
Absolutely.
Instead of creating all these, engineer or even some of our clinicians now thinking, okay, I see a gap in my patients. I really needed to produce this better testing, better tools, better services to capture them early, or perhaps just engage with them to have better treatment, right? Whatever that means. However, in that conversation, doesn't matter who is the leading recognizing voice, we needed to consider everybody else in that process and not just saying, oh, I spent $1 million to fundraise to actually create. Now, hey guys, see this solution, but sometimes people don't even recognize the solution exists or even aware there is a problem that needs a solution without the proper conversation way up front. That means when we're creating, whether it's just simply advocacy, policy change, innovation, we have to get our physician involved. We have to get our admin team involved. We need to get our pharmacy involved, therapists, the patients, the caregivers, right? Everybody else who can potentially be a part of the process to have them buy in and do your proper research way up front. So what do you see as, you always talk about sustainability in the smaller community, right? What are some of the major gaps that you're seeing that we needed to focusing on?
Well, there are lots of them.
Lots of things.
The size of the organization isn't the only issue, but I think it's a useful theme to focus on. So if you think about the way healthcare was done, the way medicine was done 100 years ago, and I'm not saying we want to go back to that era technologically, but organizationally, the way it was done 100 years ago was, your doctor was probably a solo practitioner, and you'd go to the office and it would get a very human experience. If you have to go to the hospital, it was probably a locally run charitable organization that with really tight links to the community, funded by the community and staffed by the community and everything else. And we've really lost that human touch. There's a book that inspired me in my thinking on this, and it's not a healthcare book. It's a business management book by a guy named Gary Hamel, who's a management consultant. But he wrote this book called Humanocracy that I really liked. Again, there are no healthcare examples in the book that I can remember, but it was all about. Part of the book was about the evils of bureaucracy. So when you have when the organization gets too big and you have so many different layers of management, then the frontline folks get really lost, and their voices get drowned out by all of the clutter in the middle, and the folks at the top get really, really insulated from what's happening at the front line. I'll give you an ethical sort of disaster example of this. Some of your listeners may have heard of the Wells Fargo scandal of a few years ago, where the CEO decided and the executive team decided that they wanted individual account holders to basically pay more fees. And so they incentivized frontline folks to sign up account holders for more accounts and more insurance policies and more other financial products that the bank was offering. And they put so much pressure on the frontline folks. Well, actually, they put so much pressure on the executives, who then put the pressure on the middle managers, who then put the pressure on the frontline supervisors, who put the pressure on the frontline folks. And you have all these layers of pressure to the point where if you're on the front line and you didn't get your customers to sign up for 8 or 10 different new accounts, then your job was at risk. And the problem is, it was impossible to get people to sign up for that many things because they didn't need that many things. And the frontline folks could have told the executives that. They could have said, this isn't working. People don't want all of these services. We're happy to offer them, but people don't need these many things. But the effect of what actually happened, because those voices weren't heard, is that frontline folks started signing up people for accounts that they hadn't agreed to. And the next thing you know, all these customers were paying fees for things they hadn't signed up for. And it was a huge scandal. And Wells Fargo paid like billions of dollars in fines. And they've gone through several CEOs since then that have gotten fired. I mean, major, major scandal, all because the top line was the executives were so disconnected from the front lines. So that's the problem with bureaucracy. It's not just that bureaucracy is inefficient and a hassle. It's that the folks who know the most at the front lines are being ignored. They're not being listened to. So I'll give you another example from the book. And this is actually a pretty sizable company, but don't know if you've ever heard of Nucor Steel. Probably not familiar with it. It's a steel. And they have dozens of steel mills. They're called mini mills that are scattered all across North America. But it's like a $30 billion a year business. So it's a pretty sizable overall company. And you would think that a company that big would have a massive office tower at their headquarters and lots of overpaid executives that work in that office tower and set goals and have spreadsheets and do all the things that executives do. And it turns out that that's not the case. Nucor Steel, as big a company as it is, has a teeny tiny corporate headquarters that has like two dozen people in it total, and they're in an office park somewhere of some suburban area. The vast majority of management of this company is done at the local level, so they run their steel mills essentially as small businesses that serve the regional customers, whether they're a lot of steel goes to construction industry. So they'll serve, construction suppliers, for example. And each steel mill has the autonomy to decide what products they make, how to set their prices. I mean, they're basically running each of these subsidiaries as if we're a small business. And the folks in charge at these subsidiaries are steel workers. They grew up doing the work, getting their hands dirty. So they know their product, they know how to do quality, and they know the workforce really well because they're one of that group. And they also know their customers and their customers' needs. So it works really, really well, and it ends up being a really profitable business doing it this way. You don't have to delegate all the decision making to the disconnected bureaucracy that's off in another city. But sadly, that's sort of what's happening in healthcare today. A lot of the shots are being called by big corporate offices that are multiple layers of management removed from the doctors and nurses who actually know what's going on.
Exactly. And I think that's the core of what needed to be focusing on. How can we, using the steel mill example of, yes, we might not, as individual clinicians, therapists, might not know how to truly build a business, but they know the relationship they build with the clinicians that they have with their patients. The back-end office who's billing the insurance understand the struggles that people going through, waiting on the phones for 20 minutes, knowing what they can and willing to do and not willing to do. So be able to say, yes, as an overall organization, we're going to be in charge with the flow of what the business means, because for us, at least in my company, we see that 12 different domains, right? From, yes, legal, financial, operations, tech, all the way to the marketing, sales, all that thing to bring in the right people, growing community, and to the people part. We cannot forget there are the optimizing culture, human and societal connection that we're actually building for any business in healthcare or business in general. So be able to have that top-down approach, have people to have more control with them is crucial. I know we can talk about it for so long, but we'll definitely bring Brian back for another episode. Everyone, please go to LinkedIn. Just simply type in Brian Jackson in the search engine. You can find him and subscribe to his newsletter, because I can't wait for your books to come out and for all the fun things that you have been discussing, and then we've been discussing even behind the scenes for a long time. All right. And hope everyone have a wonderful day. Until next week.
Thank you.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.